I was terrified. Really had a hard time going to work at first just because I had no idea kind of what we were jumping into. Some days we feel like, wow, we're really helping a lot of people, but inevitably there's going to be those days where you just are really feeling, uncertain and almost bitter about, putting yourself and your family in this position. We're in the clinic every day having tons of positive COVID patients coughing all over us. Yet we're in this mask, we're wearing mask and face shield, and very few of us have gotten sick. So, that speaks volumes for what the mask is doing. Most often we're just wearing surgical masks and the face shield, hair coverings, a gown, a paper gown, and long gloves. If we are going to be testing the patient for COVID, or if they need an albuterol inhaler or something because of shortness of breath, then we have just this week actually been granted that we can now wear an N95 for those patients. So that's been a big relief for a lot of us. We saw the biggest spike in numbers in September when our students returned back to the University of Wisconsin. I think school lasted maybe less than a week. Classes lasted less than a week and before they had to change it back to virtual because the spike was just way too high. It's quite scary, especially here in Wisconsin. I remember last year we had snow on Halloween. So, people are going to have less and less options for get-togethers, and they're going to be forced to get together inside. And if they're not following social distancing or wearing masks, or if they don't believe in the severity of the virus, we're going to have some major issues on our hands. Just today, I saw that they announced that they are opening a statewide alternate care facility, they're calling it. And that's because as of today, there's only 16% of open beds available in the entire state at hospitals. So that could fill up 16%, that can fill up by tomorrow.
We obviously hoped this day wouldn't come, but unfortunately, Wisconsin is in a much different and more dire place today, and our healthcare systems are being overwhelmed.
As the cases keep going up and we're getting exposed more and more every day, it just becomes a little bit more scary that our viral load just is increasing that we're exposed to. I think we have providers who are older than 60 years old. We have providers who are immunocompromised, or they have family members who are immunocompromised or elderly. We have pregnant providers. So it's a big concern for the providers and the staff, I should say, not just providers. I try to just keep the politics out of it and just stick to the science that a mask is going to stop your own viral particles from reaching others. It's plain and simple. It works. And it protects you and it protects others.